Hello, everyone. Sherri Luke's here to talk a bit about my cultural competence course. So, what does a middle class white woman know about cultural diversity, cultural competence? Fair question. I am retired from Southern Illinois University, and while I was there and had to do research and publish, my research area was migrant seasonal farm worker or oral health. And in researching that population, I learned a great deal about cultural issues. I also taught a course called Multicultural Applied Experience in Dental Hygiene. Much of that course centers around the literature concerning cultural competence. So it's a very broad topic. I'm going to go from very broad to narrow in the course. We'll take a look at some demographics in our country. And then before we begin to talk about specific groups of people that we need to outline, we're going to outline what do we mean by culture. This is not necessarily a course about race and ethnicity, even though that's a very important aspect of culture. So we'll talk about what actually constitutes a culture and how it differs from just ethnicity. We'll discuss some general health beliefs and practices of various cultures and population groups, and then specifically some things we see in dentistry. I have some pretty interesting things to share with you as far as some oral practices that we should perhaps be aware of as we treat patients of various cultures. We'll talk about communication, how we can perhaps become more sensitive and more competent in how we communicate with people. We'll discuss some models that have been developed for cultural competency training, and then we'll finish off with a little about cultural competence in delivering health education messages. And we'll look at a case and discuss the best way to handle a situation. So I hope you'll join us. It'll be fun, interesting, and I think I'll give you some things that you can use in your everyday clinical practice.